Hello everyone, my name is Jennifer George, and I had a question. Have you ever been sitting at your desk typing away at that research paper? You know, the one that's due tonight, and you have absolutely no time to stop to deal with anything, let alone the pain you've been experiencing and the numbness and the tingling you've been experiencing for the past couple months? Well, you're sitting there, you're trying to type away, and then suddenly you have this sharp shooting pain that runs basically from your fingertips all the way up your forearm into your neck. You feel at any point your hands are going to explode. And at this point, you haven't been in this much pain since you've given birth to your first child. Well, you know, I don't know about any of you if this story sounds familiar to any of you, but for me it does. Having been a 10-year sufferer of carpal tunnel syndrome, I've had thousands of experiences just like this one. I have visited countless. I've visited countless doctors and have numerous tests, numerous hours of testing, and I've conducted quite a bit of research on my own to basically to find that miracle cure. And while that miracle cure continues to elude my research, it has given me a solid foundation of knowledge about carpal tunnel syndrome, about the symptoms, about the causes, and what you can do to get some sort of relief. Today I'd like to share some of my knowledge, some of my personal knowledge, and some of the knowledge I have attained from my research and from the doctors that I've seen over the years. So I'm going to be going over some of these things, and I'd like to share some of my personal techniques. And although my personal techniques may not necessarily work for you, my hope is to motivate you to explore your own treatment options in hopes of having you find some sort of relief for carpal tunnel syndrome. Most people have heard of carpal tunnel syndrome. However, not much is known beyond the name of the disorder. According to Tabor's Encyclopedic Medical Dictionary, carpal tunnel syndrome is pain or numbness that affects some part of the median nerve distribution of the hand and may radiate into the arm. Carpal tunnel syndrome has been linked to numerous conditions, including excessive hand and wrist movement, hyperthyroidism, rheumatoid arthritis, diabetes, genetic disposition, and, believe it or not, fluid retention during pregnancy. Some of your symptoms will include pain, tingling, numbness, a loss of functionality, meaning the manual dexterity of, just picking up fine little things, and a weakened grip. Personal experience. Yes, the weakened grip is definitely something I have experienced. I've spilt many of sodas and forks full of food on myself due to the loss of functionality and the weakened grip. So let me tell you, your median nerve, it starts at the back of your neck, and it'll run from the base of your neck and all the way through. It'll come down through your elbow, through to your forearm, where it branches off. And once it gets to your hand, to the palm of your hand, it branches off, and it supplies the movement and feeling to your thumb, your index finger, your middle finger, and the thumb side of your ring finger, and all of basically everything in the palm of your hand. So when the tissues that are surrounding your median nerve become irritated and swelled, they'll place pressure on the nerve and constrict the blood flow. It'll get constricted. Normally, the constriction and the swelling will occur typically here in the wrist area, it's all compacted. And the only thing I can say is that the result from all the constriction and the swelling you're basically in agony. Not to drag it out or not to sound like it's excruciating, but it is fairly painful. It's painful enough to wake you up in the middle of the night, shaking your hands. You feel as if your hands might explode. They may not look swollen, but with all the tension inside, it does feel as though they might explode. And quite frequently, this is one of the symptoms you will hear from a carpal tunnel sufferer, that they have a hard time sleeping at night due to the pain because of the blood flow. So if you are waking up in the middle of the night having to shake out your hands, or you think, oh no, my hands might all of a sudden explode, that might be your first sign of carpal tunnel syndrome. So, however, your doctor can diagnose your carpal tunnel syndrome. They do have tests. It consists of physical examinations and nerve conduction studies, and all of these testings are very non-invasive and are often covered by most health insurance plans. Once you have been diagnosed with carpal tunnel syndrome, you're going to want to sit down with your doctor to explain your various treatment options. There are available to you surgical and non-surgical treatment options. In some cases, you might benefit for having the carpal tunnel surgery release. However, most doctors, including my doctor, Dr. Mazur, who resides down in Santa Rosa, California, he feels that your best recovery from this is provided through early intervention and through basically conservative treatment. And according to the American Academy of Neurology, they also agree a conservative, non-surgical approach is the preferred method for the treatment. And what I've been shared with my doctor and the research that I have done in recent years, that the treatments for the conservative treatments have been a benefit to some people. And I'd like to share some of those with you. Some of your conservative treatments are a local or a systemic steroid. Your local steroid is an injection. It's injected into your carpal tunnel region here in your area. They will inject it in there and hopefully relieve some of the swelling. And the other is a systemic steroid, which you will take orally, and it will hopefully provide you with the same relief. Another option for conservative would be an over-the-counter, non-steroidal anti-inflammatory, which is going to be your basic ibuprofen, your acetaminophen, a naproxen, or an Aleve product, which is basically your equivalent of your naproxen, in conjunction with the steroid and your over-the-counter drugs. Your doctor will more than likely recommend what we have here. It is a splint. Splinting is highly recommended for nighttime use. What it does is it immobilizes your wrist. It keeps it in a neutral position. Your neutral position wants to be like this with a slight angle. You're basically stretching out your carpal region for at nighttime, keeps it stable, keeps the blood flowing while you're at night, so you're not sleeping like this. And it just allows for your body to rest. It allows for that area to get some more consistent blood flow in there. Diuretics. I've never heard of this one until I have done research. Maybe that's because at the time of seeing my doctor, I was not pregnant. So this was not an option for me, nor a concern. But, the New England Journal of Medicine suggests that you use diuretics because sometimes during pregnancy, women tend, or sometimes will get carpal tunnel syndrome. And they say that you can use diuretics because it will be safe to yourself and your baby. And along with the diuretics, they suggest the wrist splints as well. Another really great conservative option is exercise and incorporating yoga into that, because the different yoga and exercise positions allow you to stretch out your arms and your hands, and it lets you get the blood flowing in there, get different stretches, and it just keeps your muscles flowing. It keeps everything toned, and it really allows for that blood flow, and it allows for pressure coming off of that median nerve, because it is very painful when that flares up. So as I mentioned before, please consult your doctor before you just go on your own and try some of these treatments. Between you and your doctor, you will be able to come up with a treatment plan that suits you. Today I've introduced you to the not-so-wonderful world of carpal tunnel syndrome. We have reviewed the symptoms and causes, as well as the various treatment options. I've shared my personal struggles along with my ongoing treatment attempts. In doing so, I hope to spare you the long-term anguish that a late diagnosis can bring. If you do experience any of these symptoms that I have described with you today, please visit your doctor as soon as possible. Even if you don't think that carpal tunnel is the cause of your symptoms, what do you have to lose? You'll never know the answer if you don't first ask the question. Don't let yourself turn out like me. For each time a pain shoots through my wrist and up my arm, I receive a constant reminder about the consequences of procrastination. So please, don't let yourself be in unnecessary pain. Consult your doctor and get the answers that you need. If you have any further questions or would like documentation on various yoga exercises, various treatments, I also have handouts of different herbal rubs, different lotions. See me at the door, and I'd love to answer any further questions you have. Thank you for listening, and I do hope you have a great day.